Hey everyone, how's it going? I hope you're doing well out there. So in this video I wanted to talk about one of the concerns that is still surrounding the COVID-19 vaccines, and that is myocarditis. So myocarditis is something we've been knowing about with these vaccines, especially the mRNA vaccines, for quite a while now. But recently this concern has been rehashed with the potential approval of the vaccines for children, and also with some countries such as Sweden and Denmark who have recently paused the use of Moderna in patients who are younger because of the risk of myocarditis. So in this video, I just wanted to give an overview of myocarditis, what it is, some of the symptoms you might expect if you do get myocarditis, and also if I think it's still safe to get the COVID-19 vaccine. So let's get into the video. So to start off, what exactly is myocarditis? Well, if you break up the word myocarditis into three different parts, you have myo, which means muscle, card, which means cardio or heart, and then itis, which also means inflammation. So what myocarditis is the inflammation of the heart muscle. So in some cases, when people have myocarditis associated with either a viral infection or the vaccines, they'll also have the inflammation of the pericardium or the covering of the heart called pericarditis. So these are two sort of related inflammatory response that can occur when your immune system is responding to a viral infection, among other things which we'll talk about. So as far as myocarditis in the general population, overall it's an extremely rare disease phenomenon. So in the general public before COVID-19, myocarditis was known to happen between 4 to 6 per 100,000 patients. So looking at about 1 million patients, that's about 40 to 60 patients per 1 million. So not very many people, again, extremely rare. And in the area of COVID-19 vaccines, what some studies have shown, looking at millions of people who did get a vaccination, either their first or second dose, the rate of incidence of myocarditis was anywhere between 1 to 5 per 100,000 patients. So looking at about 1 million patients, you have between 10 to 50 patients per 1 million. So extremely small numbers of people getting myocarditis after vaccination. So I think it's something to just think about, that one, myocarditis is still really, really rare. It does happen, and in these studies that I'll link below, they did find that males who are younger than 30 were more likely to get myocarditis. And 3, if patients did get any sort of form of myocarditis, it was mild to moderate symptoms. So something that was not very serious, definitely treatable, and we'll talk about that in just a second, but something that didn't kill people. So those are the 3 things I would say to take away with the incidence of myocarditis. So as far as causes for myocarditis, one of the general causes for myocarditis has to do with your immune system creating an inflammatory response to viral infections. So in the era of COVID, one of the biggest risk factors for myocarditis actually is getting the COVID-19 infection. Getting myocarditis is many times higher of a risk once you have COVID-19 infection, especially when compared to getting the vaccines. The second cause for myocarditis definitely is vaccines, and besides what we've seen with the COVID-19 vaccine so far, historically speaking, the smallpox vaccine was one other vaccine that I can think of that caused myocarditis. Other potential causes of myocarditis include those who have a heart disease that is related to the heart muscle, such as myopathy, and also those who have a history of lupus and also cocaine abuse. So if you fall into any of those categories, that can definitely increase your risk of myocarditis. But again, the biggest culprit for myocarditis has to do with inflammatory response to viral infections like COVID-19. So far in the video, we know that myocarditis is pretty rare, even if you do get vaccinated. We know that some of the causes include getting actual COVID-19 related infection. So now let's talk about some of the symptoms you might expect if you were someone who did get myocarditis, or if you were concerned and want to talk to your physician about it. So some of the most common side effects include excess fatigue or inability to exercise, especially if you're someone who's regularly exercises on a daily basis. So those are some things I would definitely think about. Some other common side effects include chest pain. So specifically, if the chest pain occurs in the left area and then radiates from your chest to your arm, or chest all the way to your jaw or through your back, it might be something that could be signs of myocardial infarction as well, or heart attack. So if you're concerned about that, I would definitely talk to your doctor, especially if you have a history of heart diseases. Some other symptoms of myocarditis also include worsening heart failure. So one of the biggest signs of worsening heart failure is peripheral edema. So in your lower legs, if you have some fluid or swelling, typically found it when you do have a history of heart failure, that's something to also think about. So again, these symptoms are some of the most common. There's a really broad range of non-specific symptoms, and sometimes myocarditis can also be asymptomatic. So if you are concerned or have a history of heart disease, definitely talk to your physician, or if you're a younger patient, talk to your pediatric physician as well. Again, myocarditis is extremely rare, so these symptoms are non-specific and rare and might have nothing to do with myocarditis in the first place. So as far as treatment for myocarditis, again, like I mentioned, these symptoms are a broad range of symptoms, so really, treating myocarditis really depends on what you present with. Usually in most cases, especially if you were the rare case to get it from the vaccine, the myocarditis would be on the more mild side, and the symptoms would disappear on their own without any sort of treatments. So in those situations, we would call it self-limiting acute myocarditis, which when you break it down just means that the symptoms of myocarditis happened rapidly, so within a few days, let's say after getting the vaccine, and then over the next few days or a week, the symptoms would disappear without any treatment. If you are one of the extremely rare cases where the myocarditis is much more worse, such as those in a population that has heart disease, usually your physician will tweak the medications that you currently have so that way it can help treat the myocarditis and not cause complications if you have like AFib or arrhythmias or heart failure. So again, it's all about symptom management, something not to be worried about. A lot of the times myocarditis does not lead to anything severe like a biopsy or a heart transplant. And really in those rare cases where myocarditis really affects the patient is when they'll have to have more serious treatments. But for the general population, again, just want to reiterate, myocarditis is rare. The symptoms are really broad and can be mild to moderate in most cases. And if you get it after the vaccine, you should expect to have those symptoms resolve on their own. So wouldn't be something I'm too worried about, but again, talk to your physician about it. That's like probably the best thing you can do. So now that we know a little bit about myocarditis, some of the symptoms, causes, treatments, and what to expect if you were to get it, here are some of my thoughts coming from the healthcare perspective. One, I definitely think you should still get the vaccination whether you are younger or older, just because the risk of getting myocarditis from the COVID-19 infection itself is much higher, and also getting COVID-19 infection without protection from the vaccines leads you to even more complications such as long COVID, ICU stays, other social and economical impacts as well. So definitely getting vaccinated is the most important thing against COVID-19, just so you can have more protection. Some other things I want you to think about is that myocarditis is extremely rare, and if you were to get it, such as a young male who's at a higher risk, we do have treatments available, and in most cases, vaccine-related myocarditis is extremely rare and mild to moderate and would be potentially self-limiting. So therefore, treatments wouldn't be too harsh. You wouldn't need a heart transplant or anything like that. And lastly, I would just, if you're really concerned about myocarditis, really just talk to your physician. If you're a parent who's worried about their son or daughter potentially getting myocarditis, which is absolutely reasonable, talk to your pediatrician because there are specific recommendations they would make because they know obviously you or your family a lot better. But I think the general consensus is if you or your family is cleared by your physician and appropriate to get the vaccines, getting COVID-19 vaccine has a low risk of myocarditis and would definitely protect you against much worse things such as COVID-19, myocarditis, and also the other things like that. So if you enjoyed this video, thank you for watching to the end. Make sure to like and subscribe. Check out the links below because I did put quite a few resources in case you want to do more digging on your own. Thanks for watching, and I'll see you in the next video. Take care.